The Doctor's Journal, brought to you by Medical Associates Hospital, Jameson and O Snacks.
Ladies, how many pads a day do you change? 1, 2, 10? Right? If you have that many pad changes in one day, chances are you have menorrhagia.
This is a debilitating situation for many women. Today on the Doctor's Journal, we unpack menorrhagia. Welcome to another episode of the Doctor's Journal. Today we explore common but often overlooked issue that affects many women, menorrhagia.
Menorrhagia refers to heavy or prolonged menstrual bleeding that can interfere with a woman's daily life.
Let's explore this condition and discuss its causes, symptoms, and treatment options.
Yes, Dr. Mike, menorrhagia is a medical term for the abnormally heavy menstrual bleeding during a woman's menstrual cycle.
It is characterized by bleeding that lasts longer than 7 days and involves soaking through one or more sanitary pads or tampons every hour.
That's right, menorrhagia can result from various underlying conditions caused by hormonal imbalances, uterine abnormalities, or medical conditions like fibroids or polyps.
It can also be related to certain medications like blood thinners, intrauterine devices, or even blood clotting disorders. But what are the symptoms?
Well, Dr. Mike, the symptoms go beyond heavy bleeding. It can include fatigue, weakness, shortness of breath due to anemia caused by the excessive blood loss.
Yes, menorrhagia can significantly impact a woman's daily life, causing missed work or school days and affecting her social and emotional well-being.
Your gynecologist can provide a proper diagnosis and offer appropriate treatment options.
To diagnose menorrhagia, your doctor will review your medical history, perform a physical examination, and likely order blood tests to check for the presence of anemia.
Additional tests such as an ultrasound or a biopsy may be necessary to identify any underlying causes.
Let's take a quick break. When we come back, we have a discussion with a gynecologist regarding treatment.
Welcome back to the Doctor's Journal. If you're now joining us, we're discussing the topic of menorrhagia, a disorder that affects up to 1 in every 5 women. For us to really grasp the impact of menorrhagia and the impact it has on our daily activities, we have Dr. Shireen Kalu, specialist obstetrician and gynecologist, and a featured doctor on the upcoming CNC3 program, the Baby Journal. She's here to share her knowledge and expertise. So in front of us here today, Dr. Kalu, we've got our liners, our regular pads, our nighttime pads, and we have some colored dye to represent a period. So how about we show them what a normal period looks like? So you tell me when to stop.
Okay. Keep going.
Great.
All right.
Okay, last one, nighttime pad.
All right.
Great, so that's what's normal. So tell me, Dr. Kalu, how many pads would you say are normal for one woman to change per day?
So it depends on the individual, and a regular period will normally last about 7 days.
Right.
The first couple of days being light and the last couple being light. So during the time that you have a regular flow, you're looking about 4 to 5 pads, which you just nicely filled up, and this is a regular pad.
Right.
We're looking about 4 to 5 of those over a 24-hour period, changing it, of course, every 4 to 5 hours.
Okay, so that's helpful. So what would you say is the normal symptoms that you would get from people with menorrhagia then?
So menorrhagia is really a heavy menstrual flow. So it's a heavier period than normal. And far too often we find that there are patients who accept a heavy period when it isn't actually a normal period. And I think this happens because they would be accustomed to seeing other members of the family with a heavy period, and they just grow used to a heavy period being normal. But we want to tell our audience today that a heavy period means that you need to see your gynecologist. And
Very important.
what a heavy period means is heavier than what you just saw. And we're looking at maybe this pad, this is a regular pad that would be used. We're looking at changing about 3 to 4, maybe 5 of those every hour over a period of 2 hours, if that is what is happening, with or without clots. And I believe that Doc here is going to demonstrate how heavy that is as well. Then we're looking at menorrhagia, which is a heavy period.
Okay, so what would you say is the amount of blood loss you'd see in menorrhagia then, if you had to quantify that for us?
So if we had to quantify, we're looking at this amount
Right, so that's blood loss per day.
per day,
Right.
correct.
So this
So
would be,
It's about 80 milliliters or more,
right,
as opposed to 35 to 40 milliliters
Okay.
or more per day. So that's regular, and this is heavy menorrhagia.
okay, so let's show them what heavy menstrual bleeding should look like on these.
Sure. So this will be on the so-called light days, right?
Right.
Yeah, so there's overflowing or flooding, as they call it.
Right. That's an important thing for them to learn, flooding.
Correct.
Right. So they see you see this spill out, and that's
All right.
Right.
And of course, you can get clots as well. So, yeah, let's
Right.
show them what the clots would look like.
right.
Right, so with menorrhagia, you actually get the clots as well coming down, and you have certain symptoms that you would expect the patients to have. So when you're seeing the clots coming together with the heavy flow and you have to change these pads regularly, that is considered menorrhagia. Also, if you're using the tampons, which I'm sure you're going to demonstrate how to use a tampon, but if you're using the tampons, you get overflow. So you have the tampons in, and within an hour, you have overflow. It
Right.
means that you have too much bleeding and you need to visit your gynecologist.
So here I have a normal period amount as well as a regular tampon, and here Dr. Kalu has the amount for menorrhagia as well as a super tampon. So we're going to dip it in and we're going to show you how much it absorbs during your period. So as you can see, one tampon will not be enough to soak up all the blood for menorrhagia. So we're going to use this model now, and if you want to help me demonstrate, so we're just going to show you how to properly put in a tampon, just for general knowledge.
So this is the vagina, this is the cervix, and this is the womb. So we're not going anywhere past the cervix when we put a tampon in. You're inserting this part into the vagina, and there's a plunger here, so you're basically pushing it out there, and then you remove the plastic packaging and the string hangs out of the vagina.
Right? So that's the accurate way to put in a tampon.
At Athena Clinic, we're committed to helping you boost your confidence and live your best life. Enhance your appearance with a non-surgical procedure or optimize your health with one of our expert doctor consultations and diet and fitness plan. Call today at 282-2262.
Is it difficult for you to go to the doctor? Then call us today and get a doctor at your doorstep. Our qualified team of doctors are ready to help, and we specialize in convenient at-home care, including blood tests, pap smears, diabetes management, vaccination, and so much more. Get the care you need and get a doctor at your doorstep. Call 480-4DOC to set up an appointment or to get more information.
This is the best Black Friday sale at thebesttoys.com.
With ride-on starting from as low as $299. Barbies and accessories starting from as low as $49.
We have remote control cars from as low as $69.
Little Tikes playsets from as low as $159.
We have water guns from as low as $25.
Tricycles from as low as $249.
And bicycles from as low as $720.
Bubble guns from as low as $29. Baby bottles and accessories from as low as $10. We've got Graco from $340 and Baby Trend from $469.
Visit us in store at Forces Flagship McBean, first floor Movietown Porterfield, Eastgate Mall Trinity, or shop online now.
You don't want to miss the best Black Friday sale.
We have the best toys at the best prices.
Dr. Clue, we've got so much more questions to ask you, so would you care to join us?
Of course.
So, firstly, I'd like to ask you, how many tampons changed per day is considered excessive for menorrhagia?
So first of all, tampons should be changed every 4 to 5 hours. So if it is that you're using tampons, we don't want you to end up with infection or toxic shock syndrome. So we would like for you to change your tampons every 4 to 5 hours. But if you have to change a tampon maybe every hour, or that is now considered a lot of bleeding, so that is when we would say you need to check your gynecologist.
Okay.
Find out.
How does menorrhagia usually affect your patient's life?
Well, patients generally need to understand that they have a problem, and it's only when it affects their life then they understand that they have a problem. And they will still try to rally through with it because they just don't want people to know they have a problem, and that's something we have to deal with. The problem is when it affects their work and they're unable to go to work. They're worried about seepage of blood, so they're at work and they keep checking to see if there's blood. And generally, if they have a heavy bleed, they would have anemia. Anemia is where the blood count drops very low. And of course, the symptoms of anemia will be associated with that. So shortness of breath, tiredness, chest pain, those are some of the symptoms that we would not like our patients to have, but unfortunately they reach to that point and then they attend us at the office.
So as you talk about checking your gynecologist, how would you diagnose someone with menorrhagia then?
So first of all, the patient would have to recognize that they have the symptoms.
It's important.
So in a general, this is why we encourage well woman checks. So a female who comes to the gynecologist for her checkup, we would ask the questions. How many pads would you be using a day? How many days are you bleeding? Is it more than 7 days? Are you passing clots? How heavy is it? And that is where we may be able to elicit whether they have menorrhagia, heavy periods or not. Because what may be normal for them is not really what is normal.
Yeah, typically no.
Correct.
So what would be the usual treatment for these women then?
So once we diagnose the problem, the treatment will depend on the causes.
Okay.
So there are many causes of heavy period or menorrhagia, and it can extend from hormonal causes. So we need to make sure we check things like the thyroid function, as simple as it sounds. Yes, that can cause a problem. Polycystic ovaries, very common now, so we ask patients to make sure so we can rule it out. And then we do simple ultrasound scan. So the simple ultrasound scan will be able to identify whether there are any fibroids in the cavity of the womb, any polyps, there's a condition called adenomyosis, which is an extension of endometriosis, and we're seeing a lot of that now. And endometriosis in itself is a cause of heavy period and menorrhagia.
So I'd like to address the stigma that is attached with heavy menstrual bleeding and for patients to even say, hey, I have a heavy period, I need to get help for this. They talk to their auntie and their mummies, but then, it stays right there and then they don't actually go out now and go seek that help.
Yes. So that it is a serious problem that women face. I believe it is a stigma, and it is because of, as you correctly said, the mummies and the aunties and the people who are in the home may not think it is abnormal because that's what they have been experiencing. So it is programs like this where we are able to educate women to know this is not normal. You're passing more blood than normal during your period. You're changing your pads every hour. You're changing 3 to 4 pads.
And that's abnormal.
That's abnormal, and you're passing clots with it. Please don't think it's going to stop. If 2 hours have gone and you have been still experiencing the problem, go and see your gynecologist.
Yes, it's very important. I know we covered some of the causes before in our episode, but can you say some of them for our viewers now?
Sure. So I do see a lot of menorrhagia patients in the office, and there are many causes. We can start off with hormonal causes, such as the thyroid problems, such as polycystic ovaries, and then there are physical causes, polyps, fibroids, endometriosis, adenomyosis. There are patients who may be taking medications such as aspirin that can cause precipitate heavy periods as well. There are cancers when they're in the late stages, like cervical cancer, that can cause it as well. And there are a host of other causes. Bleeding disorders can cause it as well. And there are patients who use things like turmeric. You may find that the turmeric or saffron, so you need to find out from your patient the history of what, not just medication, but herbal medication and other products they may be using at home that contains the products that can cause bleeding.
Because a lot of them think it's a clean out.
Correct, and it is to some degree. So there are patients who, after they have a baby, for instance, they would have the older folks at home tell them,
Bring their saffron
you need
tea.
you need to drink your saffron tea for your clean out. Doc, what do you think about it? It's okay, but make sure you monitor your blood loss when you do that, because you don't want to bleed excessively.
Because saffron is a blood thinner.
It is.
will thin the blood.
Correct, and that's why you have to know what you're doing when you're taking it.
So what tips and tricks would you have for those patients experiencing menorrhagia?
So what I would say is you visit your doctor, find the cause of your problem, initialize medical treatment. It's always important for medical versus surgical.
Right.
And of course it depends on the patient's age, etc. So your doctor will be the best one to tell you what is best for you, but always medical, followed by the option of surgical. And what I have learned over the years is with a heavy period, sometimes you may find, like for instance in the nighttime, if it's very heavy and you'd want to be comfortable so that you can sleep through the night, you can wear one of the overnight pull-ups or the adult diapers that would be used for patients with incontinence, etc. That can be used, and you would sleep comfortably,
Not be worried.
not worry about messing up the sheets, not even having to get up to go and change a pad every hour.
Yeah.
But if that happens, remember, you still have to see your doctor as soon as you wake up in the morning, okay? Or you go through the emergency department at the hospital once you find it's too much bleeding.
Thank you so much, Dr. Kalu, for joining us. All the information you shared is so relevant, so important, and I'm hoping that it helps a lot of women out there sitting down on their couch now thinking, wait, I might have menorrhagia. So join us after the break for more. Thank you so much.
Thank you for having me.
Are you looking for a customizable studio space with green and white screen cyclorama and professional production equipment to carry out your next big project? SGP Studios is the perfect fit for you. TNT's largest studio space with an overhead lighting grid and sound treated, perfect for television commercials, music videos, television programs, social media content, and film productions. We also have a wide range of production equipment available for rental. You can choose from a selection of Netflix approved approved cameras, modern lighting equipment, professional audio gear, 40-foot and 20-foot cranes, gimbals, drones, lenses, action cameras, and more, all at competitive prices. Whether you need a high-end cinema camera for a feature film shoot, specialized lighting equipment for a music video, or audio gear for a podcast, we've got you covered. And with our easy online booking system, you can reserve the gear you need in just a few clicks. Check us out online at sgpstudios.com.
This is the best Black Friday sale at thebesttoys.com.
With ride-on starting from as low as $299. Barbies and accessories starting from as low as $49.
We have remote control cars from as low as $69.
Little Tikes playsets from as low as $159.
We have water guns from as low as $25.
Tricycles from as low as $249.
And bicycles from as low as $720.
Bubble guns from as low as $29. Baby bottles and accessories from as low as $10. We've got Greco from $340 and Baby Trend from $469.
Visit us in store at Forces flagship McBean, first floor Movietron Port of Spain, Eastgate Mall Trinity, or shop online now.
You don't want to miss the best Black Friday sale.
We have the best toys at the best prices.
Hi, I'm Nandini Samuel, a registered dietitian, and today I will be speaking about nutrition and menorrhagia, or what we refer to as heavy bleeding, which lasts more than 7 days. The occurrence of this condition can cause nutrient deficiencies, especially with iron, which can eventually lead to iron deficiency anemia. Low iron stores can cause you to feel weak and tired often. So some examples of iron-rich foods are meat, eggs, liver, spinach, peas and beans, and even seafood. Emerging research is actually showing that a vitamin A deficiency can lead to an increased risk of menorrhagia. Vitamin A-rich foods are like sweet potatoes, bell peppers, broccoli, liver, eggs, mangoes, papaya, what we call pawpaw, fortified foods, fish, and dark green leafy vegetables. Other vitamins and minerals that play an essential role are the vitamin E, B vitamins, omega-3 fatty acids, vitamin C, calcium, and magnesium. You may want to avoid the consumption of any spicy, sour, or heavy foods, as well as any sort of ultra-processed foods. Lastly, probiotics are shown to be very beneficial to rebalancing the microbiome and reducing gut inflammation. Research is actually showing that a healthy gut bacteria and the use of probiotics can improve certain hormonal conditions that may lead to menorrhagia. Today we are going to be preparing a simple chia seed kombucha drink. So here we have some flavored kombucha, and guys, you can use some plain kombucha as well. And we also have some chia seeds. So chia seeds is very rich in antioxidants, and it's like a nutritional powerhouse. So I just want to add some of our chia seeds into our drink and give it a nice mix. And there you have it, guys, a chia seed kombucha drink. You want to remember to have this at least once a day after meals, and you can drink at least 4 ounces at a time. It's easy and simple as that.
This segment was brought to you by O Snacks.
Well, guys, and our lovely lady listeners, that concludes our episode on menorrhagia. Remember, understanding your body and seeking timely medical advice is crucial for your overall health and well-being.
If you or someone you know is experiencing abnormal menstrual bleeding, don't hesitate to contact your healthcare provider.
This was the Doctor's Journal. I'm Dr. Mike.
And I'm Dr. Sunarine. Take care of you for us.
The Doctor's Journal was brought to you by Medical Associates Hospital, Jameson and O Snacks.